It's been dubbed the pingdemic. Hundreds of thousands of people pinged by their NHS Covid app and told to quarantine. So bad it's left businesses with no staff and people stuck at home for 10 days. But now is the time to change how the app works.
We had rising case rates, and it's inevitable that we had the app doing exactly what it should do, which is identify close contacts frequently. However, we're in a slightly different position now. We're trying to open up, we're trying to balance. We have our most vulnerable people protected with the vaccine, and hopefully we are now starting to see a plateauing and a bit of a decline.
At the moment, people are pinged and told to isolate if they've been in close contact with a positive case 5 days before their test. That will now be lowered to 2 days, but only for asymptomatic cases. In 2 weeks, if you're double vaccinated, you won't need to self-isolate at all. With nearly 700,000 alerts sent in 1 week, the app has meant Hayley's cleaning business has virtually ground to a halt. More than half her staff are isolating and none has Covid.
I've had to drag my 75-year-old father into help at times, and my mum, and obviously close family members. But I've had to stop the domestics for a while, the domestic side of the business. And I'm only doing a quarter of my commercial work.
So this change in the app couldn't have come soon enough for you?
Yeah, fingers crossed.
The success of the vaccine has meant more of us are asymptomatic and less likely to pass it on. Crucially, the sensitivity of the app and risk threshold hasn't changed.
It will have some negative impact, but probably only marginally, and the benefits of not having to quarantine for what is ultimately quite low-risk contacts is, I think, outweighs the disadvantages.
Health officials don't know how many people this will impact yet. It is an experiment, but one businesses are very pleased to see. Emily Morgan, News at 10.